federal drug agents are taking aggressive steps to combat prescription drug abuse. We do have Devlin Barrett joining us to tell us about it. Devlin, this is a very serious issue. We're concentrating mostly on a situation going on in Florida right now, but it certainly has national consequences. Tell us exactly what the Federal Drug Enforcement Agency has done in Florida.
Yeah, it's a pretty interesting case because Florida is really the epicenter of what's viewed as this just rampant prescription drug abuse problem in this country. And what's going on in Florida is the DEA has taken action against a major distributor called Cardinal Health. They're a $100 billion a year company, and two CVS retail outlets. And it's the first time really that the DEA has moved in a significant way against one of the major chains as they try and clamp down on the supply of all these prescription drugs that are just finding their way onto the streets.
Right. So basically, the accusation here is these two CVS stores sold a disproportionate number of certain kind of addictive prescription drugs. Is that right?
Right, and it's essentially purely a numbers argument that the DEA is making. You know, this isn't a case where they, placed informants and gathered a lot of evidence and that sort of thing. They simply looked at the shipping numbers, and what they found was you've got two CVS locations in the town of Sanford that received more than 3 million pills last year. You're talking about a town of maybe 50,000 people, so you're talking about essentially almost 60 pills for every man, woman, and child in that town. And the DEA basically said, look, this is way out of line. There's clearly a lot of pills being diverted here into the market, into the black market, into the inappropriate use market. And so we're going to yank your ability to sell controlled substances.
And this is actually taking the fight to a legal showdown. They're going to go to court as this new strategy of the DEA kind of going after the larger corporations. So what is really the significance of the outcome of this? Is there any indication on how this will play out, and again what the significance on a national level might be?
It's interesting because the DEA seems to have clearly decided that if they really want to get control of the prescription drug abuse in this country, they have to start dealing with the big players, and they have to get tougher with the big players, and that means companies like Cardinal. And so what they're doing, the DEA administrator has described the distributors as essentially choke points in their strategy, and so what they're doing is they're trying to force those big companies to more aggressively help them police this problem. And what's interesting is the big companies have the resources, unlike a lot of mom and pop pharmacies. The big companies have the resources to put up a fight on this stuff. So what you saw just on Monday, there was a court hearing on this, and there were dozens of lawyers in that courtroom all gearing up for this fight that's coming later this month.